Hello again. A Mpumalanga doctor has been hijacked and robbed at gunpoint earlier this week. Attackers also attempted to rape her. This is just one of many attacks on health workers. Recently, a nurse was gunned down by a boyfriend, a police officer at Tembisa Hospital. Well, for more discussion on this ongoing violence against healthcare workers, here's Dr. Mvuyisi Mzukwa. He's the vice chair of the South African Medical Association, SAMA. Dr. Mzukwa, thank you very much for joining us. Yeah, it's not a good setup. It's not a good environment at the moment. I mean, it can actually be very scary. And it is tragic as well that people of your profession, your colleagues, have become targets to violence and criminal acts.
Thank you so much, Braden, and good afternoon to your viewers as well. I think it's a very problematic sketch, as you know it, because if you look at it, healthcare professionals have been in the battle against the pandemic, and as you know, they are very exhausted. Their morale is low. They need some encouragement, some appreciation. But I think safety in the workplace is a responsibility of an employer. We know that there is general crime in society, but when it comes to the workplace, it is the employer that must make sure that employees are kept safe all the time, especially healthcare workers. You don't expect that in a sacred environment like the hospital, you should get criminals finding their way through, and as if nothing, nothing happens after that. There's no arrests, there's nothing. It's just like business as usual.
Dr. Mzukwa, what can the employer do here? I'm asking this against the context that says you've got a hospital that's managed, it's got its own management, so it's employing the nurses and the doctors in that particular institution. But at the same time, you've got the Department of Health, which is a government site that oversees the sector. Where is that responsibility lies in SAMA's view?
Well, it lies with the head office. The department, the National Department of Health, we should be also going down to the provinces as well. But you can't leave, those CEOs as well scot-free when it comes to responsibility. We expect government to function in a unified manner. We don't expect that you can have a fragmented system like we have now, where you find that a national government does not know what happens in the provinces. And the provinces hardly know what's happening in the hospitals. And that leaves us at risk as healthcare workers, because you then have those institutions that are dysfunctional with dysfunctional measures like your CCTV cameras, which are just decorating buildings and they're not functional. And you also have all these other things where people just get in the hospitals willy-nilly, in the clinics willy-nilly without any checks and balances. And you don't have even those metal detectors, that should be protecting healthcare workers. Who must die for the health, the Department of Health to take, these measures seriously? Who must actually die?
Yeah, thank you very much. It's a very tragic situation there. Good question there. Who must die? How many more must die, in fact, in the healthcare sector before the healthcare workers are protected? That's the question as we end that interview with Dr. Mvuyisi Mzukwa, Vice Chair of the South African Medical Association. Now let's bring